checking any doctor's orders if there is any. So when I go into the patient's room, I want to make sure that I'm washing my hands, making sure that the patient has a blanket and is in a gown, making sure that the bed is put up to the appropriate working height for me, making sure that I'm providing privacy for the patient, so closing the curtains or closing the door. And then we will get started. So hello, my name is Sierra. I'll be your student practical nurse for today. Can you tell me your name?
Kristen Moore.
And your date of birth?
June 8th, 01.
Okay. So today we're going to be doing a head to toe assessment. So I will just check your wristband. Good. So we're going to be doing a head to toe assessment. So I'm going to be feeling you and touching you and using my stethoscope to listen. Is that all right?
Mm-hmm.
Okay, so I got verbal consent. So I'm going to want to wash my hands before I start. So we're going to start with general overview. So general overview of the patient. Patient looks relaxed. Patient looks calm. Patient is flushed. Patient doesn't have any support systems along. So do you have any support systems?
At home.
At home. Patient has support systems at home. Again, patient is relaxed, calm. Patient is not crying. Patient is very monotone. Not crying. The patient doesn't look like they're in pain because they're not doubled over or holding anything that they are in pain. Overall, patient looks healthy. Patient doesn't have any IVs or catheters. By the looks of it, I don't see any casts or braces. No O2 therapy. So at this point, I would want to take a full set of vitals. So I'd want to take my blood pressure, my pulse ox, my respiratory rate, my temperature, and my pulse rate. And then I'd want to chart all of those as well. So now we're going to move into neurological. So we're going to start with neurological questions. So have you ever had any head trauma, such as concussions or blows to the head?
No.
No? Have you ever had any surgery of the head?
No.
Have you had any seizures before?
No.
No? Do you have any family history of Alzheimer's or dementias or epilepsy at all?
No.
No? Have you ever had a seizure? I think I asked that already. Do you ever feel lightheaded?
No.
No? Okay. So after I take my health history of my neurological, I'd want to start with my orientation. So what is your full name?
Kristen Dawn Moore.
Your date of birth?
June 8th, 01.
Do you know what day it is today?
April 13th.
Do you know what time of the day it is?
3 o'clock.
Do you know where we are?
Earl Grey.
Okay, so patient asked all of those without any hesitation or any mix-ups. Patient knew where we were, what time of the day it was, so I wouldn't proceed with a MOCA or a mini mental assessment, as she did answer all those. So if patient was concerned, or if there was any concerns with any of those questions, or patient didn't know where we were or what year or time it was, I want to make sure I follow up with a mini mental and a MOCA. So now we're going to do a balance and coordination test, okay? So I'm going to get you to put your hands on your laps, and we're going to do supination and pronation of the hands as fast as you can, kind of playing patty cake, back and forth like this, as fast as you can. Good. Now I'm going to get you to stand up. And we're going to do a Romberg test. So I'm going to get you to put your arms straight out, close your eyes, and we're going to put our arms here just in case the patient falls. We want to check for balance and if the patient has any swaying. Good. You can open your eyes. So there was very minimal swaying. Her balance is good. Now we're going to do a walking gait test. So we're just going to walk all the way up there and turn around and come straight back. Good. This patient has really good balance. Patient is also following my commands very well. And she's also following me with eye movements. So I don't see any signs of any neurological disorders or anything that worries me for neurological. So you can sit back down. So we're just gonna check some of our cranial nerves now. So we're gonna start with number 3. Cranial nerve number 3 is papillary responses. So we're going to check the constriction of the pupils. So we're just gonna shadow up a little bit and just look straight ahead. And I'm going to check the constriction of the pupils. So the papillary responses of the eyeballs are equal. Both eyeballs constricted. We're going to just follow my pen light now too. So just follow this. Good. So patient follows my pen light very good, so she has very good eye movement. So now we're going to move on to number 7, cranial nerve number 7, which is facial expressions. So we're going to do some silly faces, okay? So can I get you to raise your eyebrows, puff out your cheeks, smile, frown, make a crying face. Good. So patient has really good facial expression responses. So now we're going to move on to cranial nerve number 11. So I'm going to put my hand right here, and I want you to try to push my hand away with your head. Good. And now the other way. Good. Can you shrug your shoulders? Good. This patient has really good strength in the neck and the shoulders, so cranial nerve number 11 is good. So now we're going to move on to our head and neck portion. So we're going to start with our head and just work our way down. So I want to inspect the head and the hair. So at first glance, I don't see any lesions or bruises or bumps or lumps. Hair is shiny, it's blue, looks clean. I don't see any dandruff. Color of the scalp is white. No noticeable lumps. So now I will palpate the skull, feeling for any tenderness, ridges, lumps, bumps, and asking the patient if they feel any tenderness. So I'm just going to feel your head. Let me know if you feel any sore spots or anything that hurts, okay? Anything? No. So I didn't feel any ridges or lumps or bumps, no tenderness, no soft spots on the head, and the patient had no pain. So now I'm going to move to the face. So looking at the face, facial features are all symmetrical. Very good hair distribution of the eyelashes and eyebrows. Skin is light pink. Looks dry. Nose looks symmetrical. Face looks symmetrical. Lips look symmetrical. Facial expressions are all symmetrical. So now I'm going to move to the eyes. So first I'm going to ask some eye health history questions. So do you wear eyeglasses or contacts?
No.
No. Have you ever had surgery of the eyes?
No.
No. Have you had any trauma to the eye, such as like glass shards or anything going in your eye?
No.
Have you ever had surgery on your eyes?
No.
Do you have any color blindness?
No.
No. Do you have any eye pain upon movement?
No.
No. Okay, so we're gonna start with doing an eye exam. So we're gonna see her visual fields first. So just tell me when you can see my hand, okay? Just look straight ahead.
Now.
Okay, and then this.
Now.
And I already got patient to follow my pen light in neurological, but I'll do it again. So just follow my pen light. So patient can follow my pen light very well. I already checked papillary responses. I will check pupil size now. So it looks like patient is about a 3 on the pupil size. 3 or 4, probably closer to a 4. We're going to check the eyelids. So the top eyelids look healthy, pink in color. Can I get you to pull down your bottom eyelids like this? Good. So bottom eyelids are pink and moist in color. I don't see any obstructions in the eyes. And yeah, eyes look good. Now we're going to move to ears. So her ears look like they are a normal size for her head. There is 2 piercings, 1 in each ear. I don't see any lumps or bumps or bruises or lesions on the ears. There is no discharge coming from the ears. The skin of the ears is light pink in color. Other than that, ears look healthy. If I had an otoscope, I'd want to make sure that I look into the ear for any obstructions in the ears, looking at the tympanic membrane. So I want to make sure that I palpate around the ears. So I will do that. Just let me know if you have any tenderness, okay? Anything? No. No? Okay. So there was no pain around the ears on palpation. So now I'm going to move to the nose. So looking at the nose looks symmetrical. The sternum of the nose looks straight. Have you ever broken your nose? No. Do you have any trouble breathing? No? So it doesn't look like the patient has done any harm to the nose. It looks symmetrical. I don't see any lumps or bumps or bruises or lesions. I will look into the nose. So can you look up for me? There is a nose piercing in the left side of the nose. There's nose hairs in the nose, which is normal. There's no obstructions in the nose. The nostrils look equal. The sputum looks straight. The inside of the nose is light pink in color. So I want to make sure that I am palpating the sinuses now. So I want to palpate the frontal and the mandible sinuses. So frontal sinuses, just let me know if there's any pain. And then these sinuses down here, making sure that there's no pain. Any pain?
No.
No? Okay. So I also forgot in the eyes that if there is any eye pain, you want to make sure that you palpate the lacrimal apparatus. So going around the eyes in a circular motion, you want to make sure that you palpate that. So just like this. Any pain? No. No? So no eye pain when palpating lacrimal apparatus. You want to make sure that you ask if the patient has ever had any eye socket breaks at all, just because it would hurt them a lot if they did have that. So now we're going to do a nasal patency test. So I'm going to get you to cover one nostril and blow out the other for me. Good. And this side? Good. So nasal patency test, it looks like the left side is a lot weaker than the right side. But the airflow is very even. I don't see and I don't feel any obstructions. Overall, the nasal patency test is good. Now we're going to move to the mouth. So first appearance of the mouth, the lips are pink, plump. They kind of look a little dry. Can you smile? So when you smile, both sides of the mouth are equal, so no signs of any strokes. So can you open your mouth for me? Put your tongue down. Good. So looking in the mouth, I don't notice any sinuses. So have you had your sinuses, I don't notice any tonsils. Have you had your tonsils removed?
Yes.
So patient has had tonsils removed. But other than that, I notice a full mouth of teeth. There's none missing. The top palate of the mouth has no bumps or lumps or ridges in there. The gums all look pink and healthy. There is no obstructions in the mouth. There is no swelling. There is a normal amount of saliva in the mouth. So the salivary glands, are working normal. And yeah, all around the mouth looks very healthy. So now we're going to move to our neck. So we want to inspect the neck first. looking, see if there's any noticeable lumps, bumps, bruises, lesions, which I don't see any. There's very good neck muscles. Can you turn your head? I don't see any jugular vein distension, which is a very good sign. Now I want to palpate the sinuses. So I want to make sure that I'm looking for the pre and post auricular sinuses, the occipital sinuses, the submandibular sinuses, submental sinuses, superficial anterior cervical sinuses, posterior cervical sinuses, supraclavicular sinuses. So I want to make sure when I'm palpating that I am feeling for all of those lymph nodes. Sorry guys, my brain is going crazy. So I want to feel for all of those lymph nodes as I'm palpating the neck. So we're just going to palpate, let me know if anything hurts. Any tenderness? No. Any pain? No. So no pain and no tenderness while palpating the neck. So now I just want to check the range of motion of the neck to make sure everything is good and there's no limitations. So can you look to your left? Look to your right? Look up? Down? Can you do a circular motion with your neck? Good. So I don't see any limitations with the neck movements. So now I want to move down to my extremities. So would you be able to remove your shirt for me? So I'm going to start with my upper extremities. I'm going to start with my arms. So upon first look at the arms, I notice a tattoo on her right arm, or right elbow. I don't notice any swelling or edema, no pitting. Skin color is light and pink. On her left arm, I notice another tattoo. Even hair distribution on both of the arms. Fingers and digits look very healthy. I don't see any clubbing of the nails. There is polish on 2 of the nails, 3 of them actually. Nails are all, there's no cracking. Fingers look good. Skin looks healthy, no lesions, bumps, or noticeable bruises. So I want to make sure that I am testing my skin torque. So I want to make sure I pull the skin up a little. There is no tenting on the left side. We'll check the right. No tenting on the left side. So there is no signs of dehydration from the patient. So I want to make sure that I am testing the strength. So can you squeeze my fingers as hard as you can? As hard as you get. Good. So you want to make sure that you cross your fingers so that patient doesn't break your fingers. So while she was squeezing my fingers, I noticed that her hands are really cold. Are you cold? Yes. So patient is cold, but her arms feel warm, but hands are fairly cold. So now we want to check the range of motion. So as we're doing range of motion, we want to make sure we're checking for any bogginess or crepitus of the joints as well. So we're going to start with the wrists. So can you do in circular motions? Good. So I feel a lot of bogginess and crepitus in the right wrist. We'll check the left. Okay. Good. So a lot of cracking and popping and crepitus in the left wrist. Now we're going to go to the elbows. Okay, just bend back and forth. Good. And this one. Good. So I felt no crepitus or bogginess. I heard no popping or cracking of the elbows. So we're going to move to the shoulders now. So can you do circular motions of the shoulders? Good. And this one. So in her right shoulder, I felt a little bit of crepitus, but not a lot, and I felt nothing and heard nothing in the left shoulder. So now we're going to want to move down to the lower legs, to the lower extremities. So we're going to move down here, and we're going to look at the legs. So upon first inspection of the legs, I noticed that her feet are a little purple, but that's probably because her legs have been dangling off the table. There is a tattoo here, a little bit of blotchiness around the knees. Her skin temperature is warm, no edema or swelling or pitting. I'm going to do a skin tissue torque test, so there is no tenting. While I'm down here, I'm going to do a cap refill test of the toes. So she does have polish on her toes, so I will just test right above the nails. This one. So cap refill of the feet are under 2 seconds, which is very normal. I will check the fingers here. Good. So fingers are also under 2 seconds, which is good. While I was down looking at the toes, I didn't notice any clubbing of the nails. Her toes look really good. They're kind of a little crooked. She has really long toes. Other than that, everything looks good. We're going to check the strength of your legs now. So can I get you to lay down? Okay, so we're going to do gas pedals. So can I get you to pull your toes towards your nose? Good. And now push. Good. You can sit back up. So the patient has really good strength in both upper and lower extremities. So now we're going to move to the chest. So we're going to start with inspection of the chest. So upon looking at the chest, I don't notice any lesions or bruises or bumps or lumps. I see her collarbones, they're very sticking out, but I don't see anything. So I'm going to palpate the chest now. So just let me know if anything hurts open. Anything hurt? No? So I'm also going to check cervical pulses right away while I'm here. So the pulses were equal. They were bounding, but normal. We're going to check pulses in the radial. We're going to make sure that they are equal, so we're going to check and compare. So radial pulses are equal. They are both bounding and steady. Okay. So now that we did the front chest, we're going to do the posterior chest. So can you turn around? So looking at the posterior chest, I notice some acne. I don't notice any lesions or bumps or bruises. No scarring at all. So I'm just going to palpate the back chest. Just feel for any masses or lumps or bumps. Okay, so I don't feel any lumps or bumps or masses at all in the back chest. So you can turn around now. So now we're going to move on to respiratory. So we're going to start with our health history questions. So do you have any lung diseases?
No.
Do you have COPD?
No.
No? Okay, do you have a cough?
No.
No? Do you have any trouble breathing?
No.
Have you ever had pneumonia or anything like that?
No.
Do you have any family diseases of pneumonia or lung cancer?
No.
No? Okay, so now we're going to listen to your lungs, okay? So when listening to the lungs, we want to make sure that we are listening to the top, the apex of the lungs. I think that's what that's called. And then we're going to listen to the back of the lungs. So I'll get you to turn around again. So we're going to be doing a zigzag pattern while listening to the lungs. So we're going to start with the tips of the lungs at the top. So can you take a deep breath in? Out. In. Out. In. Out. In. Out. In. Out. In. Out. In. In. Out. In. Out. In. Out. In. Out. In. In. Out. Okay, so I hear normal breath sounds of the lungs. So normal breath sounds are your vestibular sounds. So those are your lower pitched rustling sounds. Then you have your bronchial lung sounds, which are your harsh sounding. And then you have your bronchial vestibular sounds, which are a combination of both. So to me, I think she has vestibular sounding lungs. So out of the normal lung sounds would be your fine crackles, which are high pitched sounds, your coarse crackles, which are low pitched bubbling gurgling sounds, your wheezes, which are your musical sounding, musical squeaking sounds, your sonorous bronchi wheezes, which are your low pitched moaning sounds. And then you have your strider sounds, which are your high-pitched crowing sounds, and then your friction rubs, which are coarse, low-pitched rubbings of the lungs and the pleura together. So none of those sounds were heard upon auscultation of the lungs. So now we're going to do our tactile fremitus test. So that is our 99. So I'm just going to put my hand on your back and I'm going to get you to say 99, okay? Okay?
99.
Again?
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 99.
Okay. So I feel normal vibrations of the lungs on both sides. They are equal. So now we're going to do our respiratory excursions. So we're going to get the patient to take very deep breaths in and feel the lung expansion of both lungs. So we're going to go like this. Take a deep breath in. And out. And again. So after doing that, both of the lungs are rising and falling at the same time. They are both equal while rising and falling. One isn't going higher than the other, which is very good. So yeah, the lungs are very good. So I'll get you to turn back around now. We're going to do our cardiovascular now. Our cardiac, because we already did respiratory. So we're gonna start off with some cardiac questions. So have you ever had a heart attack?
No.
Have you ever had a stroke?
Nope.
Have you ever had any heart problems?
Nope.
Have you ever been diagnosed with a murmur or anything like that?
No.
Have you had any surgery of the heart?
No.
No. Do you have any blood clots at all? No. Do you have any like chest pain at all?
No.
No? Okay. So now we're going to listen to the heart. Making sure that we are listening to the aortic, the pulmonary, the tricuspid, and the mitral points of the heart. And then also making sure that we're listening to Herb's point. We want to make sure we're listening with our diaphragm and our bell of our stethoscope. So I'm going to go ahead and do that. And we also want to make sure that we can hear both S1 and S2, and then listening to hear if we can hear any murmurs or S3 or S4s. So I'm going to start by listening with my diaphragm. So we're going to start with our aortic. Tricuspid, pulmonary, sorry. Now tricuspid. Just down here. Mitral. And then back up to Herb's point. So S1 and S2 sounds were heard. I didn't hear any S3 or S4 sounds with my diaphragm or murmurs, but I will listen with my bell now.
And then down here.
Okay, and then Herbs. Okay, so no S3 or S4 sounds or murmurs were heard upon auscultation using my bell. So now I'm going to move to the breasts. So when doing breasts, you always want to make sure that you have two people in the room, which I don't, so I wouldn't touch anywhere around there. I would just ask a question, a couple questions, and then I'd want to make sure that I teach a self-breast examination. So have you ever had a breast examination?
No.
Have you ever talked to your doctor about having a breast examination?
Yeah.
Okay, so I'm going to teach you how to do a self-breast examination. You're going to want to stand in the shower with your arm above your head, and you're going to want to feel in circular motions around the whole breast, feeling for any lumps or bumps, or any masses that you feel, and then make sure you're going into your armpit to feel your axillary lymph nodes, making sure that you can't feel those. You want to do those on both sides, and then you're going to want to stand in front of a mirror with your arms by your side, looking at the symmetry of your two breasts, and then you want to look at your nipples, so making sure that they are circular and symmetrical and there is no discharge or bleeding from those, making sure that there's no lesions or bruises, and if you do see anything like that, making sure you're calling your doctor right away. Okay, so I will also do genital right away too. So genital, again, you want to make sure that you have two people in the room with you. You can't touch or examine anything without a second person in the room while doing genitals, so I will just ask questions. So, do you have any lesions or bumps or bruises or anything out of the normal down there?
No.
No? In your anus area, do you have any hemorrhaging or bleeding?
No.
No? Do you have any pain?
No.
Or swelling or redness? No? Have you ever had a pap smear?
No.
No? Have you ever talked to your doctor about getting one? Yes, okay. When was your last menstrual cycle?
Last one.
Good, was it normal?
Yes.
Yes. Are you taking any medications like birth control or anything?
No.
No? No birth control or anything. So that's all I would do for a female genital examination. For male genital, I would want to make sure that I am asking pretty much the same questions. Asking if there's any lesions or bumps or bruises on the penis, and then I'd want to teach them how to do a testicular self-exam. So for that, you want to make sure that the patient is doing it at least once a month while they're in the shower. You want to make sure you tell them that they want to palpate their scrotum, holding one testy in their hand at a time and rolling it in their fingers, feeling for any bumps or lumps. And if they do feel anything like that, making sure that they're going to the doctor right away to get it checked out. So lastly, we're going to do is abdomen. So can I remove your blanket? Okay, I'll get you to lay down. So when assessing the abdomen, you want to look if there's any lumps or bumps or noticeable masses, any bruising or lesions. I do notice a belly button piercing in the patient's belly button. I can see her abs and the bottom of her rib cage, but other than that, everything looks normal. So you always want to make sure that you auscultate before you palpate because you don't want to move anything around. So I'm going to auscultate in the 4 quadrants, the right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. So I will do that now. So in all 4 quadrants, hyperactive bowel sounds were heard. But if I didn't hear anything like that, I'd want to make sure that I listen in each quadrant for a full 5 minutes. So now that I listened with my stethoscope, I'm going to want to palpate. I'm palpating for any masses or bumps or lumps that I can feel in the abdomen. So I will palpate in all 4 of the quadrants. So just let me know if there is any pain or tenderness, okay? Any pain or tenderness?
Nope.
No. Okay, so there was no pain or tenderness or masses found upon palpation of the abdomen. So now that I have done my head to toe assessment, I want to make sure that the patient gets dressed again or covers back up. I want to lower the bed, put the side rails up if the patient needs them, making sure the call bell is in with reach. I want to make sure that I chart my vital signs and anything that I found while doing my head to toe assessment, and I want to clean all my tools that I used, and I think that's it. Safety and chart everything that I did. Thank you.